10 to 20% of pregnancies end up in miscarriages, which means a lot of women during their reproductive years have experienced at least one miscarriage. Yet nobody seems to be talking about it. This week is Baby Loss Awareness Week, so we will be discussing recurrent pregnancy loss, and the grief that surrounds it. If you are experiencing or have experienced a miscarriage, I'm very sorry for your loss. It can be one of the most difficult times a woman can go through. It is very hard to explain how someone feels after losing a pregnancy, especially to someone who's never experienced it before. This type of grief is known as disenfranchised grief. Disenfranchised grief is a type of sadness that is not commonly recognized or validated in society, such as losing a pregnancy. Nobody talks about it and nobody really gives it the weight that it deserves. When you lose a pregnancy, you're not just losing and mourning the loss of a child. You're mourning the loss of the potential this child could bring to your life. You're mourning the loss of the dreams you had for this child. You're mourning the loss of the life you envisioned for yourself. It is not something to get over quickly in a few days. It can often take months, even years. You need to create space and feel the feelings you're feeling. Allow yourself to feel sad because it is a sad occasion. It is a sad situation you're finding yourself into. People often think pregnancy loss only happens when you have a miscarriage, yet it can happen in many other ways. If you're going through IVF and you've had a transfer or a couple of transfers, yet you have no pregnancy as a result, this is also a very similar type of grief. For 2 weeks after your transfer, you've lived as if you were pregnant. You know that there was a growing baby inside of you, yet at the end, you don't have a positive pregnancy test. So it's the same type of grief. It's a grief for something you worked really hard to achieve, and yet you have no results at the end. It's very hard experiencing implantation failures and miscarriages. There's no guideline on what to do. Everyone must do what they feel is right for them. Some people want to keep trying. Some people would rather take a break. Some people think this is the end. I don't want to do this anymore, and that is totally up to you. Everyone should take the decision that feels right for them. But I do feel you should always allow yourself time to grieve. You should own your grief. You should write down what you're feeling, what you are losing, what you hope to have, and what you don't have at the moment, and feel the pain, feel the discomfort, because it is only then you will begin to process and try to move on. I also feel people who experience recurrent pregnancy losses tend to struggle more because they keep having the same situation happen over and over again. Usually people are very supportive when someone has a miscarriage, but if you had 2, 3, 4, 5, even more, people don't know what to say. They don't know what to do. They think because you've experienced it before, you're used to it by now, as if someone can get used to feeling tragedy. They think, oh, she probably knows what she's doing by this stage, and usually support and communication tapers off, which is ironic because the more miscarriages you have, the more support you need. The more you need people to call you, take you out of your funk, to ask you, are you really okay? I know this because I've had 4 miscarriages myself, and even though I've had many difficult situations in my life, I've always felt fertility issues and recurrent miscarriages to be one of the most difficult. There's a sense of powerlessness when it comes to fertility-related issues. You can't throw money at the problem. You can't wish away the problem. There's a sense of powerlessness, a lack of control, which a lot of people struggle with, which is totally understandable because in any other situation, if you're in a bad relationship, in a bad job, you can just get out of the relationship, find a new job. But with recurrent pregnancy losses in general, and IVF, you can't do that. You don't have the option. You just have to either keep trying or make amends that this is your fate, which is also very difficult. What advice I would offer to someone going through pregnancy loss is to just take time for yourself. Take time off work. I think workplaces should be giving paid time off to women who have experienced pregnancy losses or going through IVF. We're still far away from that, but take time off. Experience what you're feeling. Write down what you're feeling. Own it. Just process it. And then when you're ready to face the world, I would suggest do a lot of non-fertility related activities. If you're lucky to have friends who are not interested in having kids or don't have kids and they're just living their life without thinking about fertility related issues, hang out with them. Go on hikes, ground yourself with nature. Nature is very good at kind of stripping back life and making you think what is important. So immerse yourself in nature, surround yourself with people who won't trigger you. You know yourself, you know what your triggers are. Surround yourself with people who won't ask the questions that you don't want to hear. You need to get out. You can't stay in bed and just ruminate over it because it's not going to change anything. It's very hard to do. It's very easy to just sit and think, oh, if I'd done this, maybe the outcome would have been different. Maybe I should have eaten this. Maybe I shouldn't lifted this. But at the end of the day, if you were meant to stay pregnant, you would have stayed pregnant no matter what. And if you weren't, that's just fate. Think about people in wars and famines. They're probably leading very stressful lives and they still manage to get and stay pregnant. So it's not about you being stressed. It's not about where you are. It's not about what you've done, what you've eaten. It's a roll of a dice sometimes in these cases. If you are watching this and you know someone who's gone through repeated implantation failure or recurrent pregnancy loss or any pregnancy loss at all, or even just struggling to conceive, please just support them, call on them, ask them, are they doing okay? Do you want to grab a coffee? Don't ever say, at least you got pregnant naturally. At least you're young, you can still try. It wasn't a real baby. Anything like that. I've actually done a video of what not to say to someone going through fertility issues. So if you want to have a look, I'll put the link somewhere up here. And I'm really sorry for anyone who's had to watch this video and has experienced baby loss in any form. If you do want to watch more videos about fertility and general lifestyle videos, please like and subscribe. And I really hope everything works your way in the end. Bye.